Hey everybody, Professor Klein here in the Human Anatomy Lab at Ohio University to bring you a video on the blood flow in the legs. Alright, we're going to be using these pictures here. I did not draw these pictures. These are too well drawn for me. Shout out to Alyssa Siebert, one of the graduate physical therapy teaching assistants who drew these out. What are we looking at when we look at here? Well, first off, this is an anterior view. Anterior view right here. So if I zoom in, you can see the patella, which is anterior of the knee. Up here, you can see the pubis bones, sacrum in the back, so you know this is anterior. And what we're doing is we're coming down from the abdominal aorta. And let's start there, right? We know how to get to the abdominal aorta. Here's a picture of how you might do that, getting down here. But after the abdominal aorta, it splits. And it splits into a right and left common iliac. So this side would extend the same as the right side here, but we just see the right side. So assume it's on the other side, but you can only see it on the right. So what does the common iliac turn into? It splits again, and it turns into the internal iliac deep in here and the external iliac. We're focused more on that external iliac because that one's going to keep going. The internal just stops in this region. So where's the external go? Well, it comes down and it crosses the inguinal ligament. So the probe right now is representing the inguinal ligament. Here's a picture of where that is. Once the external iliac artery crosses this ligament, it's going to become the femoral artery, because now we're in the femoral region. And this one is the one that you see in the femoral triangle. Here's a picture of the femoral triangle, knowing that this is anterior. But as you come down, this artery is going to go medially and then posteriorly. So you can see here the dotted lines represent posterior structures. So dotted line, popliteal artery would be the back of the knee. That comes down and splits again into the posterior tibial and the anterior tibial. Well, guess what? Anterior, now we're back in front. Posterior stays posterior. They're both coming down. And what you got to know is that the dorsal pedis is a branch of the anterior tibial, top of the foot. But the posterior tibial keeps coming down and goes to the bottom of the foot, or the plantar surface. Well, what's the plantar? Let's jump over here before we hit the veins. Let me show this again, but this is showing a posterior view. So you can see the same things: abdominal aorta, common iliac, external and internal iliac. Dotted line now means you're anterior in this posterior view. Femoral, and then boom, femoral turns into popliteal as it becomes posterior. Posterior tibial keeps going down, anterior goes to the front. Where's that posterior going? Here it is, medial and lateral plantar with the plantar arch. So this would be the terminal destination of the arteries in the foot. Whoa, okay, you guys tracking with the arteries going down? And of course, if you read in a textbook, you look at a diagram, you're gonna see more branches, you're gonna see more arteries. There's a ton more arteries in the legs, but we're just gonna focus on these as we're focused on the main pathways of how do you get from the abdominal region down to the foot and back. So we've gotten down, let's get back. All right, let's pick up where we left off here with the plantar side. And of course, an artery to a vein is arterial, capillary, venual, and then the vein. In this case, we have the deep plantar arch with some plantar veins in here. And it is the same going back up if you take the deep veins. Remember, there's a difference between deep veins and superficial veins. And what you can see here is the posterior tibial vein is deep. The anterior tibial vein is deep. And those go up and turn into popliteal. Popliteal keeps going. Again, this is a posterior view. Popliteal turns into femoral as it goes more anterior. And the femoral vein is right next to that femoral artery in the femoral triangle, as you can see popping up here. Keep it going up. This will be on the other side, but past the inguinal ligament becomes external, internal, common, but then you go back into what's called the inferior vena cava. So a little bit different on the deep veins as you get up to this area, but pretty much the same from the ankle on up. But how about these other ones in here? The superficial veins, and we have some of the largest superficial veins in the leg, and these are with the dotted lines, as you can see here. First one is called the small saphenous. And this one just kind of works its way up posteriorly and then drains into the popliteal vein. So it's pretty long, but not the entire length of the leg and the thigh, but small saphenous goes up here. The great saphenous, I love that name, great saphenous, goes all the way from this medial side of the ankle, going up, going up, going up, follow the dotted line, keep going up, almost there. This one drains into the femoral vein. So if I zoom out here, you can see the great saphenous, this dotted line right here, is super long and super superficial. A lot of supers with that great saphenous vein. All right, what's that look like from over here? An anterior view. Well, anteriorly, we got superficial venous arch on top. That'd be like next to the dorsal pedis artery. Now the great saphenous is always medial. So whether you're an anterior or posterior view, it's always going to be medially. Small saphenous is more laterally. See the fibula right here. You got anterior tibial, posterior tibial, just different views of it as it gets to the popliteal vein. And then the femoral vein coming up. Great saphenous draining into that. Internal iliac, external iliac. This is a better view of the front side. My probe would be the inguinal ligament right now, as the blood would drain back to the external iliac, common iliac, and inferior vena cava. All right, if you are somebody who is more of a flow chart person, this might help you out more as it lists out the different arteries in sequence that blood would travel, and you can see where the splits are occurring with this here. The only thing I would add in here is the medial and lateral plantar arteries, which turn into the plantar arch, which remember we saw over here on the foot. But continuing with the flow chart, let's say these medial lateral plantar arteries, dorsal pedis artery, they would be up here and they would drain arterial, capillary, venule into the superficial and deep venous arches. Take your choice, posterior or anterior, popliteal. Remember, here's a good look at, you got the deep ones all draining, but then you got these superficial ones, the saphenous veins, draining into there at some point, and then making their way eventually down to the inferior vena cava. All right, one more thing to show you, because I love to show these structures, anatomy in many different ways, and in this lab we have a ton of models to show. Now the models doesn't show everything like the whiteboard drawings do, however we can see quite a bit in the models. Now if you look here, this is the femoral triangle. We got sartorius, we got adductor longus, and then I'm going to put the probe here for the inguinal ligament. Now inside you can see the femoral nerve. the femoral artery and the femoral vein. Now the artery is going this way, right? It's taking blood down, so let's follow that one down. Now what you got to do is you got to remove, there we go, remove the sartorius, and you can see the femoral artery coming down, but then it starts anterior, goes medially, and it actually goes through a hole in the adductor magnus called the adductor hiatus. And what does that hole do? Well, let me rotate it back here. It pops out posteriorly. This is the end of the femoral artery, and when you're in the back of the knee, it's the popliteal artery. So popliteal right here. All right, where does that popliteal go? Let's pop it off here. We got to pull off the calf muscles, move these out of the way. And first off, you probably see the long continuation after popliteal artery. It goes into the posterior tibial, and that one's going all the way down and around posterior to the medial malleolus right here, medial malleolus. So that's posterior tibial. It'll branch, you can't see the branches here, but into the medial and lateral plantar. Another model here, foot model. If you look at this, you can see that posterior tibial artery coming down around the medial malleolus, and then it splits into a medial plantar and a lateral plantar, and you can see a little bit of the plantar arch coming across. Let me pull this off, and you can see that plantar arch underneath a lot of the muscles. How about anterior tibial? Well, if you look here, there's a lot of different branches coming off the main pathway, right? I'm not teaching all of them, but I do have a list right here with all of them. And what it's telling me is number 80 right here, zoom way in, number 80 is the anterior tibial as it would go over. Let me flip this over and remove some of the extensor muscles. Here it is. That anterior tibial pops out, comes all the way down, comes to the dorsum of the foot, top of the foot, right, and becomes, we look here, anterior tibial coming down, it pops out the dorsal pedis right in here between the first and second digits. So here's a great shot of a cross section, anterior out here, posterior back here, medial over here, lateral over here. So we can see the anterior tibial, posterior tibial, should be coming down the back side here, and just another branch in there as well. All right, then going back up, what can you see on these models? Well, not as much. They like to show the arteries more than they show the veins. Where they pick the veins up in the knee with the popliteal vein deep in here. Popliteal would turn into femoral. Femoral would go through that adductor hiatus on its way back up, turn it into the femoral, well, still the femoral vein, but eventually stops here. But up in this region would be the external iliac vein, common iliac, and then inferior vena cava. All right, hopefully this has helped you with the blood flow pathway through the hips, through the knees, through the feet, and back up as well. Like and follow and comment any other videos you'd like me to make for you guys. I love making videos for you, and thank you so much for your support. Thanks for watching.